Intro. Hook America spends more on healthcare than any country, but millions of Americans still avoid the doctor because they can't afford it. Why? Let's find out. Scale of the problem. The United States spends over $4 trillion a year on healthcare, more per person than any other country. Yet many Americans still struggle to pay for routine care, insurance premiums, and prescription drugs. History. How healthcare started. U.S. healthcare developed differently than most countries. During World War II, employers began offering insurance as a benefit to attract workers. Over decades, this system evolved, giving rise to private insurance companies, complex pricing, and administrative overhead. Insurance and middlemen insurance companies, pharmacy benefit managers, and billing firms all add layers between patients and providers. Hospitals charge one price, insurers negotiate another, and patients often pay a different amount entirely. Why prices are so high? Prices rise due to several factors. First, there is no standard pricing. The same procedure can cost $500 at one hospital and $5,000 at another. Second, prescription drug pricing allows companies to set prices freely. Third, administrative costs in U.S. hospitals are far higher than in other countries. Who benefits and who suffers? Large corporations, hospitals, and insurance companies benefit from the system. Middle-class families, small business owners, and retirees often face high debt. Medical debt is now one of the leading causes of bankruptcy in the United States. Why change is difficult? Reform is challenging because of political divisions, lobbying, and dependency on employer-based insurance. Any major change affects jobs, profits, and elections. Conclusion. Closing the U.S. healthcare system didn't become expensive overnight. It evolved over decades through policy, corporate influence, and economic incentives. Understanding it is the first step toward meaningful change. Call to action. Subscribe to America in Context for weekly documentary-style explainers on U.S. systems, economy, and society. Stay informed and understand how America works.